The head of the UN Ebola Emergency Response Mission has told the General Assembly that the epidemic has turned and that the devastating spread of the killer virus has indeed slowed. Ismail Ahmed said the worst affected countries recorded sharp declines in new cases. The good news has been welcomed, but authorities remain cautious.
Liberia, once the worst affected, has recorded the sharpest decline from averages of 300 cases per week in September to less than 10 cases per week today. Strong resistance from communities remains a challenge in Guinea, but new cases still declining from 114 in December to 30 in the past week. Sierra Leone has the highest case incidence at 140 per week.
We must assure that complacency and donor fatigue do not prevent us from reaching our goal. Despite the progress achieved in the Ebola response to date, the fight is far from won. Ebola continues to be a global threat. Every day, people continue to be infected and die of the disease.
Donors have provided almost $2.5 billion in humanitarian assistance, while the African Union and ECOWAS was praised, among others, for deploying over 800 skilled volunteers.
The affected countries are starting to assess recovery needs and to prepare for post-Ebola life. I have instructed the UN system to begin, in parallel with the response, work on the restoration of essential services and planning for early recovery. We are focusing on access to health care for common illnesses, food security, reopening schools, and ensuring care for orphaned children.
The UN chief said his Ebola Trust Fund used to fund priority gaps had been depleted and urged donors to continue their support. Shervin Briceby's SABC News, New York.